Greetings, this is the coronavirus COVID-19 update for 3/3/2020. So we always start by looking at the numbers from China. These numbers are not finalized today. It's already 9:08 p.m. China time, and their deadline is 9 or 10 o'clock, depending on which announcement you look at. Changed data yesterday to be updated after the announcement of the National Health Commission. So that's the changed data, the delta numbers, which are usually smaller numbers beside these 6 major numbers. But we'll just go with this because it's probably pretty accurate. So far they say cumulative diagnosis as of today is 80,303 cases, 587 suspected cases. Recovered people 47,606, and people who are in the ICU in severe cases 6,806, and deaths are at 2,948 in China so far. So this is Baidu, which Baidu is a Chinese search engine, and they have this page set up, which I have in the description below if you want to take a look at it. If you scroll down this page, there's a lot of other information here that I scan through every day. So this is the map, which hasn't changed a whole lot. The legend on the left, I think they revised that today. Then if you scroll down further, you'll see 2 graphs. This is the first one, and this shows you new deaths, 31, which even though the numbers at the chart at the beginning aren't officially updated yet, they're in the graph. So new diagnosis up 128, which is really low. If you look at the red line, it's trending down, and this is the lowest number that we've had since probably December. And added suspected cases is also very low, and cured people is trending up every day, which is good news. And this is the second graph, and it shows non-Hubei province at 14 cases, and Hubei at 114, and bringing the national number of new cases to 128. And these numbers aren't out yet. This is what I take a look at just for Wuhan, but it would be close to the graph that you saw on the previous page, minus 14. And these are the hot stories of the day. If you scroll down, you'll see the search terms. And the search terms don't always make sense because that's what people use to search to find the hot topics of the day. And sometimes the terms are a little misleading. So we'll take a look at the 5 of these today. One was this first one, official response, Hubei Yunming concealed epidemic. Sometimes it's hard to tell what exactly the story is by looking at the search terms. So this first news story just basically says that out of Hubei, the incremental risks have not yet been fundamentally controlled. So Hubei still has a lot of new cases every day, even though it's down today. And that's not exactly new news, but this is an official announcement that still more than 20,000 patients in the province who are being treated in a hospital. And that's a lot, even though they built 2 new hospitals, 2 new 1,000-bed hospitals. Their hospitals naturally are overwhelmed because they had 13 or 14 hospitals in Wuhan. And they're all overwhelmed. And then on the right, it's kind of a funny story where a guy is taking 100 yuan bills, and which are about $20, and put them in a microwave to disinfect them, and they kind of got toasted. And then a story out of Great Britain. I haven't been tracking Great Britain in the international section because Great Britain pretty much has things under control. And then there's an announcement here that the Japan Olympic Committee reached an agreement to extend the Olympics to the end of the year. That we'll go over that when we take a look at Japan, but that's kind of up in the air, even though it's a possibility. And then we take a look at the Johns Hopkins tracker, global tracker, which if you saw the video yesterday or the day before, Germany's people use this Johns Hopkins tracker to see what's going on in the world. So we'll take a look at the numbers, compare that with in the Baidu number from today is 80,303, so we're 150 short there. So to get an accurate number of the totals confirmed, you'd have to add 150 to that. So that would, put us up a little bit over 93,000. And these are the three hotspots that we take a look at that are outside of China. So that would be South Korea, Italy, and Iran. And if you look on the right, under deaths, total deaths from Hubei province in China is 2,835. But if you expand the Chinese data and take a look at it, of all the provinces, numbers like 21 and 13 are the second highest deaths in any province in China outside of Hubei province. And here, Italy and Iran are at 79 and 77, with South Korea at 28. So these are alarming death numbers here. And, that's why these three hotspots are, a concern. So I left this WHO article up here from yesterday that WHO is still in Iran, or the second day in Iran, and they're saying that South Korea, Italy, Iran, and Japan are their biggest concerns. I'm not quite sure why Japan is being mentioned in the same sentence, because that shouldn't be that big of a concern. So the first hotspot is South Korea. So we're taking a look at South Korean news. There's really nothing in here to explain the increase, but it's down from the increases the last few days. But the news coming out of South Korea is the president declares war on COVID-19 as deaths there reach 31. And he commits billions of dollars to fight the virus, and he also apologized for the inconvenience caused by the insufficient and slow supply of masks. So, maybe the U.S. should do that too, because you can't buy a mask in the U.S. right now anywhere online. Everybody advertises it when you go in to actually order something, everybody's out, and that's because all the masks are being manufactured are being given to health officials. And this is something out of Korea that I left up from yesterday just because it's pretty cool. These are smartphone apps in Korea, and there's a few different apps that they gave examples of, but these apps will warn you when you come into an area where somebody was confirmed with coronavirus. And that might not make sense if you're just looking at it from the aspect that you don't want to get near somebody else that has the virus. The thing is that other person is moving around, so you don't have that on this app. You just have where this case was confirmed. But it would be helpful, if you see like a hot zone. And a hot zone from like a community virus, they call it, where you don't actually contract the virus from a person, that you get it from something. Like there was something that made the news a week ago where a prayer mat actually contained a virus, and that was inside of a monastery. So it helps you stay away from hot spots anyway, even though the people might not be in that hotspot anymore. They might be standing next to you. But anyway, the app is pretty useful, and it'd be nice to have it in all across the world. And in the next area is Italy. The news out of Italy is that the deaths are at 79. China cases are slowing. Italy's elderly population are bearing the brunt of the coronavirus on the lower left. And this is a hospital staging area, this tent behind that guy is a staging area, and this picture was taken in front of a hospital. So they're kind of following the Chinese model there, where you stick staging areas, outside of a hospital and that's where you go first. And what do we have on the right? It says that in Italy they're asking doctors to come out of retirement, and they're expediting nurses, to graduation so that they can help. So both of those are good ideas, and if that might be a good model for the rest of the world to follow. Trying to get doctors out of retirement for a little bit to help if you're short on doctors. Then Iran, the left thing is just probably written by ISIS. Somebody's saying that the sanctions are going to, affect Iran's ability to fight this virus, but that's bullshit, because Trump already declared that through the Swiss embassy that the U.S. is prepared to help Iran, and we're not going to take the sanctions off of Iran for shooting down an airliner just because they're having trouble getting masks or something like that. If you're a country and you have a healthcare system that actually cares about the people, then you should have things in place inside of your country, and you shouldn't have to rely on everybody else. But the U.S. committed to to helping Iran with drugs, and that still holds true. So, and then Iran's reaction to the coronavirus has become a danger for the world. That came out of the Washington Post today, and that's true, but it happened, a week ago, where this pilgrimage to a religious site is where all this stuff started in Iran. But that's true. It's, that reaction is a danger for the world. That model is saying, well, we don't want to keep people from going to this pilgrimage. Go there, enjoy yourself. Yeah. And you stay in a hostel with other people in bunks. Everybody's sleeping together, everybody's dining together, and everybody's together, in the shrine. So it's a hotbed for spreading a virus. And then another piece of news out of Iran today is Iran temporarily frees 54,000 prisoners to combat the spread. So these are people who were sentenced to less than 5 years. They're letting them out of prison to help out. Okay, then after the 3 hot spots, there's a few other countries here that are of a little bit of a concern. Japan, I mentioned, went from 274 yesterday to 293, so that's not much of an increase, and it doesn't really look like Japan is out of control. France from 191 to 204, that's not that much of an increase either. We'll take a look at each one of these countries. So first, in Japan, I mentioned the news earlier where the Olympics are being postponed, but here it says Japan Olympics minister hints the games could be held later. The IOC insists that Tokyo will go ahead on time, and then so these are conflicting stories. I think the IOC in Japan met and decided that we could postpone the Olympics, but no decision's been made yet as far as I can see. And then what else do we have on the right? Asthma drug seems to be effective for COVID-19. So this is Japanese doctors using an asthma drug. So that's, good news. A lot of different drugs are being used. A lot of American AIDS drugs are being used by people too, as far as treating the symptoms. It doesn't really help if somebody's, if the patients are really old and have other underlying issues, because the mortality rate for those people are, almost 50%. Then France, it's hard to find news coming out of France for some reason. So there's an announcement here that France, the cases, they're up to 204 confirmed cases now. There weren't any details on this in that article. And on the right, another piece of news coming out of France is they close 120 schools and sending home tens of thousands of students. But that's a good idea. It's any country that has even a small hotspot ought to start taking measures to isolate people and keep people from gathering. Then next down is Germany. Germany is also very hard to find news on Germany, even in the German. If you go directly to the German news sites, like the World, so German World. One piece of news here: BMW quarantines 150 employees in Munich or München, however you want to say that, over coronavirus concerns. And piece of news here in the middle doesn't really say much, but this is from Deutsche World, also Welt. And the things on the right, they give you the total number of cases, and Germany also made a site, for their health people, whatever government body that is, put something up on the internet to explain what coronavirus is. So I don't know. It's like Germany's not taking this seriously yet, and that's the impression I get. Spain. News coming out of Spain. There's a guy in the upper left-hand window. Believe it or not, this is a hotel and the hotel's under quarantine. I've never really seen a window in a hotel that was quite that dusty. You have to, move the a couple centimeters of dust off of the window to see out. And then there's an announcement. Spanish pharma giant said it could have a coronavirus cure within weeks. Yeah, everybody's saying that. Nobody's done it so far. In Madrid, coronavirus cases rise in Spain after local contagion in Madrid. So saying at least 5 people in some municipality contracted without traveling to any country or any risk area. So it looks like they're experiencing some community virus transmission. Then what do we have? The U.S. So in the U.S., coronavirus live updates: U.S. death toll rises to 9, and that's ridiculous. And all of these death cases in the United States are in the same geographic area, and we covered that yesterday, how the CDC is to blame for these deaths because the first woman who died was in really, really serious shape. The doctor said he wanted a coronavirus test, and the CDC said no, she doesn't meet the criteria. So she was on a respirator and she died overnight. And then now we have 8 more deaths, so bringing a total to 9, and it's all in the same area. It's all 8 of them were in the same hospital. I'm not sure if the 9th one is the same hospital. But this is ridiculous work by the CDC. I don't know why they're going overseas and concerned about, what's happening overseas when they can't handle, defining policies and procedures in the United States. So here's an article where Pennsylvania gets approval to begin COVID-19 testing in a state lab immediately. Well, nice. Up until, a couple days ago, you had to send your test kit back to the CDC, in the CDC's in Atlanta. I almost said, I'm sorry, not in Atlanta. It's in Washington, D.C. The US WHO is in Atlanta. But, it's ridiculous sending the blood sample somewhere. Why? They should have been working on this, having local test centers a month ago, and people have died because they didn't do that. Somebody ought to, reprimand the CDC, because this is just, Bush League work here. So this Center for Systems Science and Engineering, which is a research institute at Johns Hopkins, they're doing such a good job with this tracker, except for this graph. They have, for some reason, the scale on the left goes up to 85K. It should be up at 80 or 95K now, and that graph should be touching the top number, and that way you could actually see what the trend is, because this makes it look like it's leveling off, and it's not. So somebody needs to fix this. And this is the graph of the United States. If you click on any country, you should see a map of that country, and then you can see the total confirmed cases, total deaths, and total recovered. And you can also look at it by city. So you can see that we have two hot spots, in California and Seattle. That's all we have today. Thank you.